Sarah Rae. Welcome back to my channel. Happy IBD Awareness Week. IBD stands for inflammatory bowel disease. Today, in that category, we are talking about ostomies, ostomy surgeries. There is 100,000 people who get that life-saving surgery, and we are going to talk about all about that surgery and everything that goes with it in regards to IBD. So I hope you guys enjoy it. Now, if you guys want to know about IBD in general, I do have a video in regards to that we did yesterday, and that will be linked in the description box down below, so watch that video. And so you guys know the drill. Like, comment, subscribe, hit the bell for notifications of when I upload, and let's start talking. Let's first start with what exactly an ostomy is. So it's a surgical procedure that changes the way urine and stool exits the body. So bodily waste is rerouted from its usual path due to malfunctioning parts of the urinary or digestive systems. And we're mostly going to talk about the digestive system in this because we are at the beginning of IBD Awareness Week, and that's for Crohn's and colitis. So, and that is all about the digestive system. Now, ostomies can be temporary or permanent. So temporary, when they say temporary, they mean it's likely to be reversed at a later date. And permanent is exactly that. It's not possible to be reconnected. So when you hear an ostomy, you hear the word stoma. And what a stoma is the opening in the body that is created from this surgery, and it is that part of the the system that is being rerouted for either the urine or stool to be exited. So it is brought to the abdomen, and it's normally a dark pinkish color, and a pouch is worn over top of it to collect that stool or urine. Some people have what is called a continent diversion, and this is an alternative to an ostomy, and it really eliminates the need for a pouch. And I'll give an example for that here in a moment. So let's talk about types of ostomies. So there is a few different types of ostomies. There is what's called a colostomy, and that is the portion of, that takes place in the large intestine. And it is when the colon and the rectum is removed, and the remaining of the large intestine is brought to the abdomen. And when you have a colostomy, your stool is going to be a lot thicker. That is because the water in your intestine, your large intestine, that is where that gets absorbed. So your stool there is a lot more formed. So you see in colostomy bags that their stool is going to be a lot more thicker and a lot more almost formed like. Now, there's an ileostomy, and that is what I have, and that takes place in the small intestine, and a lot of times you will see either parts or maybe even all of the colon is removed. In my case, I have no colon at all, no large intestine, and there is a lot of my small intestine even gone. So, and in the small intestine, your stool is going to be a lot more looser, and that is because, again, in the large intestine is where you absorb a lot of that water, the liquid that comes with taking in your nutrients and everything. So in the small intestine and all that, not like a lot of that's missed, so that's still being not formed, so it's going to be a lot looser because that's not where it takes place. So there's also a J pouch, and a J pouch is classified as an ostomy, and this is a reservoir inside. It is made by a small intestine. I do have a video made for J pouches in particular, and I will link that in the description box down below if you are interested in learning about J pouches. But it is created out of the small intestine, and it acts as an internal reservoir to allow you to go to the bathroom as normal, and it hooks up to your rectum, your rectum, your anal cuff that's down there. So, and then there is a urostomy, which is for when your bladder is either diseased, not working properly, has to be removed, is injured. So they actually take either parts of the small or the large intestine, remove it, and replace it surgically, and parts of that acts as the opening for the kidney to be rerouted, and that part comes to the abdomen, and that is the ostomy. So that is the urostomy, and that is my phone because I keep forgetting to put it on silent. So that's how the urostomy works. And then there is the continent urostomy, which is the very same thing the urostomy is, but you don't need a bag on it like you do a urostomy. Instead, few times a day when the bladder is full, you just get a catheter tube, and there's a reservoir inside, and the catheter empties that. So those are a few different types of ostomies. So it's quite interesting, the varieties. Now I want to touch on the surgery portion of ostomies, why they happen, how they happen, and everything about that, but only on ileostomy and colostomies, seeing how it is IBD Awareness Week. So I will first tell you a little bit on how they happen. So first, it is again a life-saving procedure. They don't just do it for no reason. They have to have a reason. They will try everything else first for treatment before they go to putting an ostomy in. So, like for me, I've had 3 ostomies. This is my last one and a permanent one. It ain't going nowhere. My first one was during them putting in a J pouch. That normally happens when you're getting a J pouch. You can expect to have an ostomy put in, but it's only temporary, don't worry. My other one was because I had a narrowing in my intestine. They tried multiple different things to open it up. They thought maybe putting an ostomy in temporarily to give it time to heal might help give it a chance to open up and, you know, give it life again, but it seemed that didn't work. So in the end, because of that reason, that narrowed spot just kept giving me a lot of problems, and in the end I had no choice but to give up my J pouch because it was actually right above where my J pouch was connected, and I had to have a permanent ileostomy put in. So now, other reasons for having an ostomy put in, again, like IBD, is diverticulitis, which is looked at as a form of IBD, cancers, birth defects, things like that. And it can occur at any age. How an ostomy is put in is they will remove a part of the diseased bowel. They will take that healthy bowel that is left, that is cut, and bring that to the abdomen, and that will be the stoma, and that will get stitched to the skin. So that is how the surgery will be performed. And how after surgery will kind of go is, well, first it will really seem daunting at first, and it will take some time getting used to. And I say that very truthfully because you will miss your old life, and things like change. And that's for people, even if you're having it for a temporarily moment in time. If that sentence just made sense. But for a little bit, your stoma size will be large, but it will reduce as it heals, and it'll reduce down to 2/3 its size. And that could take about 6 to 8 weeks. It'll also be very noisy and watery, and it could have a strong smell, but all that will change over time as well, and eventually you will go home. And I do also want to say everybody's stoma size is different, so not everybody's stoma is the same. Now the next thing I want to talk about is complications that can happen with having an ostomy. The first one is bleeding. That can happen just from cleaning your ostomy, and that is completely normal. But if you get heavy, persistent bleeding, then you want to call the doctor. The next one is necrosis, which is kind of like dead tissue, and that can happen from the surgery itself, and that is because of deficient blood flow to the stoma. The next one is mucocutaneous separation. That is a mouthful, right? That is when the stoma separates from the skin it's attached to. You can get fistulas, which we've talked about in our IBD video. If you guys remember, that's when a tunneling happens connecting two body parts. You can get ulcers. You can get what's called a stoma retraction, which is when your stoma goes inwards. You can get a hernia, which is when, I hope you guys know what a hernia is, but the wall behind your stoma is weakened and your organs push through it. So you can also get trauma to your ostomy, you can get obstructions, you can get strictures, you can get what's called a stoma prolapse, which is the opposite from the retraction, which is when it prolapses, when it goes longer, when it increases in size. So those are some complications that can happen. Alright, so the next one is my favorite part, and that is where I get to tell you things that I think you should know about ostomies and life after. So the first one is the one I don't hear people telling potential people that need ostomy surgery, and that is, if you're gonna have a permanent ostomy, you're not gonna have a butthole. Nobody told me this. But it's not like you're laying there in needing to have a permanent ostomy, because that's serious. You guys, that's not like you're over there like, yeah, give me that. It's a serious thing. Like, this is a life-changing procedure. Like, you need this. But nobody told me about it. And it don't matter anyways, because I was really sick. And we tried everything. Like, I was pushing ostomy as far as I could. And it was the last thing. And they said, there's no other option. Like, we have to do this, or you're just going to get worse and probably die. And I'm like, you're joking. He wasn't. But, I had no choice. But the reason, besides you're not using it, they sew up your butthole is because it is a opening that can gain a lot of different bacteria that can be very harmful to your body, and that is not okay. So instead of leaving it there, they take extra skin and stitch it up. So, I mean, again, it's not like you're using it. So the next one's for both temporary and permanent ostomy goers, is that you will still feel the need to go every now and then, but that'll reduce over time. But yeah, you'll still feel that urge to go. The next one is that stomas have no feeling. And that is because there's no nerve endings on, like, intestines like there are on like your skin and everything. So you don't have feeling on your stoma. The next one is that you will have leakages. It is very common. So don't freak out when that happens. Another one I will tell you is that your stoma will come out to 2.5 centimeters from your skin. And that is quite interesting. But it might be a little different. It'll be around that size because everybody's stoma is going to be different. But so let's talk about sports. This is my favorite topic because people think because you have an ostomy you can't play sports or you're limited. And this is not true. And I'm going to tell you why. Because I danced growing up. Not only did I dance, I did Brazilian Jiu-Jitsu. Later in life, having a permanent ostomy. Not only that, having a permanent ostomy, I was a pro wrestler for a while. So, don't let nobody tell you you can't do anything if you have an ostomy, because I'm here to tell you you can. Now, when it comes to work, you can ease yourself into going to work after your surgery, but you can do anything you want. Just because you have an ostomy doesn't mean you have to be limited again to just a few things. But I know that you might feel a little weird having to empty your bag at work or having to change your bag at work. There are ways around it. You can get a supply bag that don't look like a supply bag. You can bring just a little pencil case that just has one bag, one little thing of your supplies, and just slip that into your bag. You can bring Poopery with you to work. I swear by Poopery. I've emptied my bag at work. I was a CNA before I was disabled. And so I worked in a nursing home. And everybody knew I had an ostomy. I'm at the point that I don't care who knows. Obviously, I have a YouTube channel, so people know. But I emptied it one day, and somebody went in right behind me. They had no idea I just emptied my bag. Until I asked them, I was like, did it smell bad in there? I was like, oh my god, I'm so sorry, I just emptied my bag in there. And they're like, you did? I'm like, yeah. They're like, I couldn't tell. I was like, Poopery. It was like, I shadow them everywhere. I'm like, Poopery, like, use Poopery. I like swear by them. But they truly are incredible. Like, no sponsorship, I swear, but there are so many different things you can use. There's deodorizers you can put inside your bag to dilute the smell in your bag. You can empty it when it's about 1/3 of the way full. So that is another way you can empty it. So there are ways you can get around it. So let's talk about clothes. So when I was young, when I had my first ostomy, I thought I couldn't wear normal clothes. But that's not true. I used to wear baggy clothes. Now I wear skinny jeans. I wear everything. I wear bathing suits because I don't care. If you have a problem with it, it's your problem. But you can wear anything you want, and if you feel uncomfortable with that, you know, you gotta remember, you're gonna be more self-aware of you having an ostomy than everybody else in the world. And the reason for that is because it's you and you have it. So that means you're going to be self-aware of the noise it makes, of how full it is, of everything. So you're going to put on pants and automatically know exactly where your bag is. Go ask a friend, can you see where my bag is? Okay? Again, empty it when it's 1/3 of the way full, you know? There's things you could do to, like, hide your bag. But you can wear anything you want to. But you want to remember to really experiment with your clothes, because sometimes certain clothes can, depending on where your ostomy is, can be less comfortable. Like if it's a really tight waistband, depending on where your stoma is, might hurt or be uncomfortable. So like mine's right on the belt, so wearing higher waisted jeans is a lot easier than normal jeans for me. And so wearing certain underwear might be harder for you, and wearing lower cut underwear might be better if your stoma is lower on the belt. Like, just experiment, find what is more comfortable for you. There are clothing pieces you can wear for your ostomy to hide it. You can tell people, you don't have to tell people. The more comfortable you get with your ostomy, the better it's gonna be. The last part is being intimate. So you might feel less attractive having an ostomy, and that can very much happen, but talk to your partner. They are definitely a big part in making you feel attractive as well. And certain positions may be uncomfortable because of the pressure that it puts on you. but there are steps you can take to make sure that you feel right in the moment for you. Things like making sure your bag is sealed, making sure everything is right in that department, that there ain't going to be a leakage. Their lingerie is a great thing to wear when you have an ostomy. There's also bands and covers you can wear. So something like this is a cute little like lace cover that you can wear, or you could wear a nude band that's going to, let me get it so it's not inside out, but a nude band that's going to hold it in place. So that is depending on how you feel, on what makes you more comfortable. That is the big thing, what makes you comfortable. So, and then again, it's up to your partner to do the rest on making you feel right in the moment. And remember, you're gonna get rejections. Just know that about it, and everything else will work great. Medications, some medications aren't going to work great and be as effective, and that is because they take longer to absorb. So liquid medications are better. And to communicate with other ostomates, we are out there, and that is a great thing. So talk to us. And lastly, 5 things that I want to discredit. First being that only cancer patients have ostomies. Again, that is incorrect, as you heard throughout this video. Number 2, that they are permanent for everyone. That is wrong. They can be temporary and be reversed. Just depends on what you are having done and what the reason is. Number 3, people with ostomies stink. That is not true, because our bags that we have built-in air filters. They actually have what's called charcoal, and that filters out any potential odors that could pass through our bags. So that is not true. Number 4, everyone can see our bags. No, you're more self-aware of your bag than anyone else. And number 5, that you can't be physically active. And I already talked about this fact, and this ain't a fact anyway, because I've disproven this. So you can be as physically active as you want. Just be safe about it. That's the biggest thing. So talk to your doctor and go from there. That is where you gotta go first. So thank you for watching. I hope you guys enjoyed the video. Sorry I filmed this so late and it's so dark. I don't have a ring light yet, so thank you for watching, and I'll see you guys in the next video. Bye.